If you have a predisposition towards anxiety or panic disorder, it's actually quite normal to get a little bit anxious if you focus your attention on your breathing. So don't worry about it, because there's a number of different breathing exercises that you can do that don't require any of your attention. The exercises are as follows. One is the breathing recovery exercise. So you might remember it as this. You're taking a normal breath in and out through your nose. You're pinching your nose for 3 to 5 seconds. Then you let go and you breathe normally for about 3 to 4 breaths or 5 breaths. In other words, a little bit of a gap with normal breathing, and then you hold your breath again. Breathing recovery, sitting, can be practiced at any time. And you don't have to pay attention to your breathing to do that exercise, but you're still getting the benefits of a breathing exercise. The next exercise that you can practice is breathing recovery walking. So this would be the paced exercise. So this is an exercise which involves you taking a normal breath in and out through your nose, pinching your nose, and walking for about 5 to 10 paces, or maybe 5 to 15 paces while holding your breath. And then you let go, you breathe in through your nose, and then you rest and recover for about a half a minute to a minute. And that's a tremendous exercise because it helps to increase blood flow to the brain. It helps also to desensitize the body's reaction to the feeling of air hunger, and it gives you a very controlled dose of air hunger, which is very tremendous because it's under your control. The third exercise involves simply walking with your mouth closed. Go for a walk and walk at a pace whereby you can sustain nasal breathing. The objective is that you're walking fast enough that you feel a sensation of air hunger, but you're not walking too fast that the air hunger is too much for you. So you should also have comfortable breathing throughout your walk. So if you go for a walk for maybe 15 minutes a day, half an hour per day, or an hour per day, during that walk, carbon dioxide is increasing in the blood because this is generating and contributing to the sensation of air hunger. So it's helping your breathing from a biochemical point of view, but also as you walk with your mouth closed, you're adding an extra load onto the diaphragm. So it's helping to improve the recruitment and also strength of the diaphragm. So there's a huge difference between going for a walk with your mouth closed versus going for a walk with your mouth open. And always remember that yes, you may not feel up to doing a breathing exercise. Instead, go for a walk. And once your mouth is closed and you have that sensation of air hunger, that can be your breathing exercise. Another aspect in terms of doing something very positive to help improve our state of mind without having to focus on breathing is taping the mouth closed during sleep. We use the tape called MyoTape. It's a tape that I developed a few years ago, and it was initially developed for children because it's so important that children breathe in and out through their nose, both during the day and also during sleep. But also the tape can be very important for people with anxiety. Because the tape surrounds the mouth, bringing the lips together, you can always revert to mouth breathing if there's an emergency. But the whole objective of the tape is to maintain nose breathing in and out. And the thing about this is that it can improve your sleep quality. And with improved sleep quality, you're waking up much more refreshed and you're going to feel less irritable. You've got more energy, you're more productive, you're in better form. We all need a restful night's sleep, and we all need to wake up feeling refreshed. How on earth could we have a stillness and a quietness of the mind? Because poor quality sleep is a recipe for an agitated mind. And I'm not talking about sleep hygiene in terms of avoiding blue light late at night. Okay, it's good to wear blue light filter glasses. Drinking alcohol late at night, okay, you fall asleep quicker, but it's going to affect your sleep quality. Eating late at night, all of these things of course affect your sleep. The bedroom should be dark, the bedroom should be airy, the bedroom should be silent, but most importantly is that breathing is in and out through the nose, that breathing is light, that breathing is slow. And another aspect then to take into consideration is relaxation. So there is a 20-minute audio that you can play, and it's designed as a progressive relaxation with a guided breathing exercise. And for example, if you feel that you're just not able to relax, why not just play the audio? Get a comfortable position, put your mobile phone onto flight mode, it's always very important, and listen to the audio and have a passive approach. Don't care what happens. This is 20 minutes that you're going to give yourself, and you'll get a lot out of it because it's a great way as well to recoup energy. We often use it during our classes, maybe at about 2 o'clock in the day. People are feeling a little bit of information overload. So I always have instructors to do the 20-minute relaxation at 2 o'clock. And it's so surprising in terms of the degree to which then they have the capacity to hold attention then for the rest of the day. So we all need to take some time out, and the relaxation, the 20-minute guided, can be tremendous as well. So there are a few exercises to practice, even if you feel just a little bit anxious about placing your attention on your breathing. You can still improve your breathing patterns. You don't have to have your attention there. So just a quick recap. Small breath holds, that's the breathing recovery sitting. Small paces, that's the breathing recovery walking. Going for a walk with your mouth closed, relaxation. And of course, taping the mouth closed during sleep, especially if you're in the habit of waking up with a dry mouth in the morning. You don't want to be waking up with a dry mouth in the morning. A dry mouth in the morning is a lighter sleep, and a lighter sleep doesn't help in terms of calmness of the mind.